Okay. So everybody understands that that's our main goal with PTCA or the cabbage, is to improve perfusion. So if you have a patient who has a heart cath, and let's say they go in through their femoral site, okay, how you take care of that is you're going to have the person lay flat for an extended period of time. You're going to have a sandbag over that femoral artery to help occlude the blood, and then you should check your pulse distal to that site. So you should be checking your pedal pulse. If there is ever a decrease in that pedal pulse intensity, or if that pedal pulse ever goes away, you've got a problem and you need to notify your healthcare provider quickly. So let's say they have the heart cath and they use the site that goes in through the radial artery. So you are going to be checking the vein distal or the artery distal to that, which is their brachial. And so if you check the brachial and it goes away or it is less, that is when you need to call the doctor and let them know that something is happening, okay? Because there's problems there. Questions about that? That's important to understand.
So you're saying, like, if they go in the leg, you check?
Yeah, like if they go in the groin, right here, and they run that site, or they run that heart cath here, we are going to be checking the distal pulse.
Okay.
Yes.
Okay.
Okay? So, for those of you who just joined, the main thing that we are talking about right now is how to manage a patient post-heart cath. And so that is just, you are going to be looking at the pulse distal to the insertion site. And if that pulse quality changes, then we want to notify the physician, because the whole purpose of a heart cath is to improve perfusion. And so if those pulse qualities change, then that's something we need to talk to the doctor about. Okay, so labs that we're going to talk about as far as atherosclerosis go, this is your lipid panel. So this is going to be your HDL, which is the good cholesterol. And remember, we want it greater than 60. All right, we're getting some of them back. Okay, so your labs, the fasting lipid panel, HDL is the good cholesterol. We want it greater than 60. Your LDL, or the bad cholesterol, we want it less than 100. Triglycerides should be less than 150. And then we're also, remember we said up here that we need to control the chronic conditions. So we're going to be looking at things related to chronic conditions. So that hemoglobin A1C is going to give us a read on their diabetic control. We can also look at things like BUN and creatinine to see if the hypertension has started affecting that. And then our, let's see, teaching. Have we went over teaching yet? I don't think we have.
No.
Okay, so we want to tell them to control their chronic conditions, to make sure to take their meds as prescribed. And remember, this is one that if they don't take their medicines as prescribed, because maybe there is some sort of financial issue, that they can't afford their medications. So if that is one that is true, then we need to, as their nurse and their advocate, we need to make sure that we give them some contact information about some agency that will help them get their medicine, refer them to the social worker so that they can start working on it as well. But a lot of times when we see non-compliance, or we see that their chronic conditions aren't being taken care of, that's why, because most of the time they can't afford it. They don't have access to go to the drugstores or things like that. So we want to make sure that, to include regular follow